Skin cancer is one of the most common cancers in the world. Every year, millions of people are diagnosed with it. The good news is that most cases can be treated if caught early. However, it's important to understand the difference between a harmless mole and signs of skin cancer. Several factors increase the risk of skin cancer, including excessive exposure to UV rays from the sun or tanning beds, having a lighter skin tone, a history of sunburns, or a family history of skin cancer. People with a weakened immune system are also at greater risk. In this video, we'll explore how to tell the difference between a mole and skin cancer by looking at 5 important features: shape, color, size, margins, and changes over time. So let's break it down step by step. 1. Shape. Moles. A mole is usually round or oval. Its shape tends to stay the same over time. Skin cancer. A cancerous spot, especially melanoma, often has an irregular or asymmetrical shape. If one half of the spot looks very different from the other half, it might be a warning sign. Number 2. Color. Moles are usually a single, even color, often brown, black, or skin-colored. Skin cancer, particularly melanoma, may have multiple colors within the same spot. You might notice shades of black, brown, red, white, or blue. Number 3. Size. Moles are typically small, less than 6 millimeters across, which is about the size of a pencil eraser. If a mole or spot is larger than 6 millimeters, it could be suspicious. However, some skin cancers start smaller, so size alone isn't the only factor. Number 4. Margins or edges. The edges of a mole are smooth and well-defined. Cancerous lesions often have uneven, blurred, or jagged edges. Changes over time can be a crucial indicator of skin health. Most moles, well, they remain the same throughout your life. However, if a spot changes in size, shape, color, or texture, or if it starts to itch, bleed, or become crusty, it could be a sign of skin cancer. There are 3 main types of skin cancer. 1. Basal cell carcinoma, or BCC. This is the most common type. It often appears as a shiny bump or a pink patch on sun-exposed areas like the face or neck. BCC rarely spreads but can cause damage if untreated. 2. Squamous cell carcinoma, or SCC. SCC is the second most common type. It can look like a scaly red patch, an open sore, or a wart-like growth. SCC has a higher chance of spreading than BCC. And 3. Melanoma. This is the deadliest form of skin cancer. It usually develops from an existing mole or appears as a new dark spot. Early detection is critical for survival. The treatment for skin cancer depends on its type and how early it is detected. Options include surgical removal, radiation, chemotherapy, or advanced treatments like immunotherapy for melanoma. The survival rate for non-melanoma skin cancer like BCC and SCC is very high, especially when treated early. For melanoma, early detection is key. If caught before it spreads, the 5-year survival rate is around 99%. Knowing the difference between a mole and skin cancer can save your life. Remember the ABCDE rule: asymmetry, border, color, diameter, and evolving over time. If you notice anything unusual, don't wait. Visit a dermatologist. By protecting your skin from harmful UV rays and performing regular self-checks, you can reduce your risk of skin cancer. Share this video to spread awareness and help others stay informed.
So, here is a quick quiz for you. Skin cancer is more likely to have A. Uniform color. B. Multiple colors. Can you guess the answer? Yes, you are right. The correct answer is B. A skin cancer spot can have uneven colors. Skin cancer is more likely to have A. Smooth edges. B. Irregular edges. Can you guess the answer? Yes, you are right. The correct answer is B. A skin cancer spot usually has irregular margins. Which picture do you think is more likely to be skin cancer? Picture A or picture B? Can you guess? Yes, you are right. The correct answer is picture A is skin cancer. What is the most deadliest form of skin cancer? A. BCC. B. SCC. C. Melanoma. Can you guess? Yes, you're right. The correct answer is C. Melanoma.
Thank you for watching. If you found this helpful, Don't forget to like, subscribe, and hit the notification bell for more health and wellness tips.